Okay, so we're still in chapter 3 and we're looking at page 61. We're in the chart of inhibitors that will increase substrate drugs, and we're going to go ahead and we're going to look at the monoamine oxidase inhibitors. So we have the three columns which say interaction, risk, and then the actions or notes. So in terms of the medications listed for the MAOIs, we have phenelzine, we have selegiline, we have linezolid. So if we have an MAOI and we add something like a drug or a food that might increase epinephrine, norepinephrine, dopamine, such as a tricyclic antidepressant, an SNRI, bupropion, levodopa, a stimulant medication, or maybe we have an MAOI and we add something that will increase serotonin. Again, this could be something like an SNRI, a tricyclic antidepressant, an SSRI, trazodone, mirtazapine, an opioid, like fentanyl, methadone, tramadol, or maybe we have an MAOI and then we add something like buspirone or dextromethorphan, lithium, or St. John's wort. So what's the risk? So the monoamine oxidase enzyme metabolizes epinephrine, norepinephrine, dopamine, tyramine, and 5-HT. So blocking MAO, so blocking monoamine oxidase with an monoamine oxidase inhibitor will then increase epinephrine, norepinephrine, dopamine, and 5-HT. So having the high epinephrine, high levels of norepinephrine, high levels of dopamine will then cause a hypertensive crisis. High 5-HT can cause serotonin syndrome as well. So what action do we take? So don't use together. Use a 2-week washout period when switching between drugs with MAO inhibition or serotonergic properties, except with fluoxetine. Then you would wait more than 2 weeks. You would actually wait 5 weeks. Also, there's a note here. Tyramine-rich foods have been aged, pickled, fermented, or smoked, including aged cheeses. So if you're having like something that is a tyramine containing food, it may be again something that is aged, pickled, fermented, smoked. It could be an aged cheese, an air-dried meat, sauerkraut, a wine, a beer. So if you're taking like a MAOI inhibitor, such as like linezolid or selegiline, and you have a tyramine containing food, you could have this risk as well. All right, so let's go to the top of our chart. So we're gonna go and look at the cytochrome 3A4 inhibitors. And adding a cytochrome 3A4 substrate. So there's many substrates. This would include like opioids, such as fentanyl, hydrocodone, oxycodone, and methadone. So the risk. So there would be a decreased cytochrome 3A4 substrate, decreased cytochrome 3A4 substrate drug metabolism, which will cause increased drug levels, and then you would have increased toxicity and adverse drug reactions. So if the opioid is the substrate, you will have increased sedation followed by respiratory depression, which can then quickly cause death. So what kind of actions do we need to take? So let's take a look. So don't use a cytochrome 3A4 inhibitor with an opioid that is metabolized by cytochrome 3A4. This combo will cause increased adverse drug reactions, including sedation. There is the note about grapefruit juice. So everyone that comes to the pharmacy always wants to know about grapefruit. Can they eat it? Grapefruit juice. So there's a note here. This is really important. So with the cytochrome 3A4 inhibitors and the cytochrome 3A4 substrates, do not take with cytochrome 3A4 substrates. Drugs that specifically include instructions of do not take with grapefruit would include amiodarone, simvastatin, lovastatin, nifedipine, tacrolimus, and there are many other drugs that also have similar risks. Moving on, let's take a look at valproate. So if we add lamotrigine to valproate, there is a note here. Valproate is an inhibitor of lamotrigine metabolism. So, risk. So the valproate is going to decrease lamotrigine's metabolism. And it's going to increase lamotrigine levels, causing an increased risk of serious skin reactions, including Stevens-Johnson syndrome, and it can be fatal. Okay. So what do we do about this? We want to initiate lamotrigine using the starter kit, and this begins with lower lamotrigine doses. We want to titrate carefully every 2 weeks. Also, we want to counsel to get emergency help if the Stevens-Johnson syndrome rash would develop. All right, we're going to move on to the cytochrome 2d6 inhibitors. So we have some examples: amiodarone, fluoxetine, paroxetine, fluvoxamine. So if you have a cytochrome 2d6 inhibitor and you add a cytochrome 2d6 substrate, many including codeine, meperidine, tramadol, and tamoxifen are listed here. So what's the risk? So we have a decrease in our drug substrate metabolism. We have an increase in the adverse drug reactions, toxicity, or decreased clinical efficacy if it's a prodrug. So avoid using together if possible. Alrighty. The last section goes into cytochrome 3A4, P-glycoprotein inhibitors, and the addition of calcineurin inhibitors or CNIs such as tacrolimus and cyclosporin, or the addition of mTOR kinase inhibitors such as sirolimus and everolimus. So what's the risk? So there would be the decreased substrate metabolism and an increase in adverse drug reactions and toxicity, including increased blood pressure, nephrotoxicity, metabolic syndrome, and other adverse effects. So avoid using these together, or reduce the dose of CNI or mTOR kinase inhibitor cautiously and based on the drug levels. Monitor transplant drug levels. And that concludes the page 61.